Thanks for joining us today to discuss information blocking. I'm Sean Sullivan, and Elinor Hiller and I co-chair Alston & Bird's Digital Transformation of Healthcare Initiative. We've been getting a ton of questions recently from clients about what they should be doing to prepare for the applicability date for the new information blocking regulations, which is April 5th, 2021.
That's right. So although we've seen some delays over the past year since the final rules were first released, that means that as of April 5th, it's prohibited for any actor under the regulations, including any healthcare provider, to interfere with, prevent, or materially discourage access to electronic health information. This is meant to encourage the free flow of healthcare information and to break down silos of information that are held by different organizations. It's also meant to give patients easier access and more immediate access to their own records. So what should providers be doing to ensure that they're not inappropriately blocking information?
It's a great question, Elinor. First, healthcare providers should be reviewing their procedures related to the release of information, including how they respond to requests for records or how and when information is made available in patient portals. Any unnecessary delay in those processes could be viewed as information blocking. Providers should also consider whether they have any policies that discourage different technology platforms or EHRs, or have any interoperability functions in their current technology that may be deactivated. These types of behaviors could also be considered information blocking. And that leads to an interesting question that we've heard a lot recently. Do the information blocking regulations require providers to invest in any new technology or build any new capabilities that they don't currently have?
So technically, no. Providers should not have to develop or acquire any new capabilities or technologies that they don't already have, simply in order to avoid being construed as information blocking. But certification standards for certified health information technology have been updated and they will continue to evolve. And some types of providers are encouraged or required by CMS programs to use certified health IT. But there are no requirements to immediately upgrade or adapt new technology in order to respond to requests under the information blocking rules. Providers just need to make sure that valid requests for electronic health information are responded to on a timely basis and without unnecessary delay based on the facts and circumstances and based on the provider's available resources.
Good. And it's important to add that providers do have only 10 business days to respond to a request if they're unable to provide the records because it's infeasible under the circumstances. So that 10 business day time frame is a good ceiling or a good maximum amount of time for responding to requests for electronic health records. But in general, the information blocking regulations really envision nearly immediate access when the data is stored electronically.
So thanks for joining us for this Healthy Bite. Thanks, Sean.
Thank you.